most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is a remake. We're going to update this one. This is tennis elbow, absolute best self-treatment exercises and stretches.
That's right.
We did this one how long ago, Brad? Quite a while, I imagine.
Yeah,
huh?
this was about 3-4 years ago at least.
All right. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to our website, bobandbrad.com. You going to bring the sign out, Brad?
I just thought of something. Yeah, I'm going to.
Where you go to the giveaway section, and we're always giving something away. This week, we're giving away a Thermotex infrared heating pad. This thing is awesome. You know, if you got chronic pain, or if you even just have regular pain.
Yeah, let's hold it up right there.
There we go.
There you go.
So this type of infrared heat goes a lot deeper than regular heat, 10 times deeper.
Right.
And you'll notice the difference. It gets into the joints.
You bet.
So you can also find it on bobandbrad.com or Bob and Brad Facebook. Go to Twitter or Instagram if you want a 60-second version of our program.
That's right.
All right, Brad, what did you think of? Now you probably already thought it.
Well,
forgot it.
You know, I wanted to show the muscle that causes tennis elbow pain on Sam.
Oh, sure.
And I don't have them prepared, so we're going to have to go without it.
That's right.
That it is. It's not a big deal at all. But we do want to talk about tennis elbow. It's really called lateral epicondylitis in the medical terms.
Right.
Which all it means is you get a sore elbow. As a matter of fact, this elbow, as I speak, has it. I am feeling that bone right there. If you get to that elbow bone right there, that's your lateral epicondyle. It's painful. I have a real mild case right now.
You've had full-blown cases.
Oh, yeah. Yeah. I mean, I can push on there now. It's tender. But if it's a full-blown case, you go like that. Ow. It makes you. And if you bump it like walking through a doorway or something, it really makes you. I said bad words once.
Right. And you don't play tennis, do you, Brad? So
No.
it really quite often is a gripping type of problem.
Right.
Like if you are doing repeated, like if you're trimming the bushes,
right,
and you're using clippers.
Yep, exactly.
That would do it. Just anything repetitive.
Yep. In my case, I was out in the garage doing some work on. It's a long story, but I was working with tools, which I don't do on a regular basis anymore. So
tools and the vibrating component of tools can make it worse.
Right.
So
anyways, it's that repetitive motion. So the first thing you do, if it is really sore, get yourself a cold pack.
Yep. And
put that cold pack on there. It's nice if you can wrap it around them. You can hold it with the other hand, but you really should keep it on there for about 15, 20 minutes. So it's get a way to put it on there and hold it on there with like ace wrap or something of that nature. You can also, which I did not bring, we did has on the other video, is an ice cup where you fill up a Dixie cup, a paper or a styrofoam cup, 3/4 full, put it in the freezer overnight. It comes out frozen naturally, and then you rip the edges off of it, and then you put direct ice right on there for 5 minutes, and that will be more than adequate to get that inflammation down.
Yeah, it's a lot faster. If you're in a hurry, you can use the frozen cup.
Yeah, it's a little messy because the ice melts, so you got to have a towel to catch the drips.
Yeah, good point.
Next one is what I'm wearing right here. This is made by Aircast, but there's a number of different manufacturers that make a wrist or a forearm brace, and this has a bladder in it. That's why I do like this one. But the other ones I've had success with too with patients. Now, if it's right there where you're going to feel the pain, you don't put it over the top of that painful spot. It's typically just below it, and it's over the meaty part of the muscle. And the idea is that when you tighten down on it, like I'm going to do here, it spreads out the force, so the force isn't going into the injured area. It spreads it out into the healthy tissues, and it's not so painful. Typically what I do with this, and I've had patients do, is a lot of times I found that when you use it and you bend your elbow, if you're bending your elbow a lot, it gets a little uncomfortable because it gets kind of caught in the crux of your elbow. That's a little bit of a problem if you're doing that. But when I'm using it or when I have my patients working, then they'll tighten it up. And then when they're not working that hand, loosen it up so you don't have a tourniquet on all day long.
That's a good technique. Now, we should say, you know, the reason the muscles actually, they attach here, but they go all the way down
Right.
into the wrist and hand.
Right.
So there's a
Exactly.
whole muscle wad here, as they kind of refer to it. And these are the muscles that are affecting the tennis elbow.
Right. They're pulling on, and we're gonna
I
have
mean, you can see like when I grip like this. Do you see how they're working?
Oh, Bob, you've been working out, haven't you?
I don't know. Do they show up?
Oh yeah.
Okay.
I'm just saying it was.
All right.
Anyways, so yeah, we're going to show treatment that we're
Sure.
going to involve that muscle belly you just referred to. But the next one, and this one has been a really successful one with a lot of people, not only our patients, but we get a lot of comments on the cross friction massage.
Cross friction massage, very helpful.
You want to go over that one, Bob?
Sure.
You do a good job with that.
We're going to go ahead and grab a pillow here because I think one, you want to get your arm in a comfortable position. But you're going to go ahead and you can take a couple fingers, or you can put one finger over the top of the other finger.
Sometimes I take 3.
And 3 fingers,
Yep.
yep. What we're looking for, you're kind of finding the tender spot. It doesn't hurt to actually work the entire muscle too, to
Right.
be honest with you. But you find the tender spot, and you're going to go across it, and you're going to rub across it fairly aggressively.
Mm-hmm.
You want to go in as much as you can tolerate. In fact, I'm not lightly just pushing the surface around here. I'm getting deep down into the muscle and tendon,
Right.
and rubbing against it. What this does, the theory is that as it starts to heal, it's forming scar tissue.
Right.
And scar tissue is real erratic. It
Yeah.
can form like a spider web.
Good description.
So what you want to do is rub over it so that it heals stronger and the fibers get more aligned. That's what they're saying in theory. I don't know what's happening in real life.
All
but
we know is we have good success with
We
this
know that it
treatment.
knocks the pain down. It gets more blood flow to the area, helps it heal quicker. This is something you can do. You can do it throughout the day, because a lot of times they recommend that you could do it like up to 15 minutes, and
Right.
nobody's going to be able to do this for
Your
15
other
minutes.
hand, I usually go myself or my patients go until your fingers get tired, and that's good.
Right. And then, a couple hours later, you can try it
Right.
again if you have time.
You really know if it's doing well is after you do it after about 30 seconds. If it starts to feel better or it feels numbish, that's a really positive sign that you're going to have success. With
Right.
that
That's a good
treatment.
point, Brad. I failed to bring that up. If you are rubbing it and it just gets worse and worse, no, you're not ready for it. Go back to the ice.
Right.
And
yeah.
ice for
Give
a
it a
while.
break.
But if you can rub it and it starts to feel better, that's a really good sign. And that means that you're going to want to continue to do it.
And the next one, Bob, the door jam
Sure.
or the corner. This is a mobilization that Mulligan came up with.
Right.
He's a
The idea here is that the problem might not be so much in the muscle, it might be almost in the joint itself.
Sure.
So, one thing you can do is you can go up to, I had a golfer that had really good luck with this.
Sure.
I mean, she actually used it for her medial epicondylitis.
Okay.
But what you can do is you go up to I've got the elbow beyond the corner here.
Yeah.
I'm not into the corner with the elbow. The elbow is just situated beyond the corner. So I'm going to take the crook of my hand here between the thumb of my first finger and our first finger, what we call it, right?
Yeah.
Yeah.
The pointer.
The pointer. And I'm going to go ahead and push in this direction. And while I'm doing that, I'm going to squeeze.
Like you're squeezing a
Yeah.
tennis ball?
Now, if this feels better, you keep doing it. If it feels worse, then you're going to go ahead and stop, and you just don't do it. It
then.
has to feel better while you're doing it.
So palm is up. Yep.
Yep.
And you open and close 10 times or
Yeah,
so?
and I'm pushing. You can go 1. You can count to 10, or you can keep a continuous pressure on there
Okay.
while you're doing this.
Sure.
So I prefer this method. To be honest with you, just applying continuous
Constant,
pressure.
yeah. All right.
So,
The next one, this is an interesting stretch. If this is the elbow that's sore, you go like this, grab your wrist, and we call it supination, but you're gonna bring your palm in this way so it faces away from you, all the way up and stretch, and just pressure on, pressure off. And you can go both directions. Try it the other way as well. And you're gonna go, if it really irritates in one direction, you're gonna go the other direction. Okay, and do that 10 times.
eventually, you want to get back to that other direction, though, because the theory is that your arm is not able to tolerate going to the end range here.
Sure.
So you want to increase that end range if possible.
Right, so we
So
get the full range of
yeah,
motion.
you do want to, if it doesn't want to go this way, work this way for a while, like Brad was saying, but eventually try to go back to that
Sure.
again.
Right.
So
Right.
really important stretch to do. I think that one can really save a lot of people, Brad. You know, if they go ahead and include that in their routine.
Yep. Yep. I agree.
I don't know that you have to do all of these by any means.
Right.
I would do the ones that seem to be successful for you.
Yep.
And stick with those.
We're just going to finish up with some strengthening, Bob.
Sure.
When it's feeling better.
Yep.
And it's not so tender, and you got more normal or near normal range of motion. You want to work those muscles and strengthen them. You can use a band like I have here with the handle. Now, this chair is a little high, darn it. I've got to get something different.
Well, I can show them right here where I'm going like this. You know, you're going to mention
Yep.
this one, right? Just using a hand weight.
Yep, little dumbbell there.
And I'm going to go ahead and work on it this way, working on extension.
Yep.
And again, you can see this is working the muscles. I don't know if you can see that or not. It's working the muscles there, the extensors.
Oh, yeah, it is very defined, Bob. I wish I had Popeye forearms like that.
No, if you got good forearms there, Brad.
Oh,
So,
thanks, Bob.
we're having a love fest here.
Usually 10 repetitions of these, all you need. If you can do like 3 sets of 10 by the time you're getting strong enough to get back out and play tennis again or whatever.
Yeah, you don't want to get things fired up here.
Yeah.
You want to just gradually increase the strength of it so that the tendon can respond to it and get thickened and be less likely to get hurt again.
Right, you bet.
So
There you go. That pretty much wraps it up in a nutshell.
all right, Brad and I can fix just about anything
Except for,
a broken heart.
but we're going to work on it, aren't we, Bob? We're
I
going
hope
to
you finally start working on it, Brad.